So without further ado, I'm going to turn it over to Beau, who's going to give us an overview of how healthy foods fit into the food security system. Thanks, Beau.
I need to start by thanking all of you for being here today. I believe that we are standing at a very important moment in our work. As food systems and healthy food and in the nonprofit sector, our world is about to change in so many ways, and hopefully for the better. So today is hopefully a start of a conversation for us to go deeper in this work as collaborating partners, as a community that actually understands what it means to do impactful work. I often talk about when I moved back to Kansas City a couple years ago that it was really a no-brainer. Of any city in this country that can do transformative, empowering work, it's Kansas City. We have the heart, we have the work ethic, we have the funding community, we have the volunteers, we have innovative thinkers, and we have industry experts. Often, though, we're missing focus. So today, in that thought of focus, I want us to take a moment to focus ourselves in this space and to think about why we are here today for the next hour and 45 minutes. Why are you here? Your question zero, your ultimate guide, your ultimate purpose, your ultimate thoughts and feelings about this space and what you hope to get out of it. And here's the catch. It needs to be in less than 10 words. So take a moment. For those of you who have an agenda and a pen, I want you to write down that less than 10 word question zero, your ultimate purpose. Why you are here today. No cheating off the top. It doesn't have to be perfect. You're not going to share it. But I want you to remember it. So write it down. Now, you're not alone in this room. There are a lot of us here. And we all have different purposes for being in this space. But there are things that unify us in this space. So what is our combined question zero, our combined purpose? What do we hope together in this space to achieve in 10 words or less? We're lucky, because we're kind of guided through this, through weighing in, that our goal is to improve access to healthy foods. Right? That's our ultimate goal. The way we go about that work is different. The means, the techniques, the theories of change, all of those things are a rich tapestry that makes this work possible. And today, that's what we're going to focus on. We're going to hear from local experts that are doing amazing work, and we're going to have them share their stories, their mission, and then we're going to engage you in a deeper conversation about what this actually means to your work and to our entire community. We hope that each of you will walk away with new information, new potential partners, and maybe even a new outlook on how our entire food system could work together to achieve our shared goal, improving access to healthy food. So I'm going to start by sharing about Nourish KC, the organization formerly known as Episcopal Community Services, and then we'll invite our partners, other partners tonight for today, to come up and share their stories. Most of you probably know us through the Kansas City Community Kitchen at 8th and Paseo. We also have a culinary training program. Those are kind of the flagships of our work. Through our rebranding process, we actually, while we're waiting on our logo, had a team create this lovely storyboard that we believe actually explains what we do. So for those of you that have that time, I'll gladly go through that later. But I want to point out 4 things. We believe that food starts, or our work starts with feeding an empty stomach. If your stomach is empty, we believe you cannot function as a member of society. You can't raise kids, you can't go to work. And not only is it just feeding you, it's feeding you healthy food. That we don't want to kill you in the process of making sure you can go to work. We know that that's the first thing we have to do. We've all been to the grocery store where we're hungry, and we make those poor health decisions. We buy that bag of chips that we open up as we're pushing the grocery cart through the aisles, making the other bad decisions of ice cream and, pizzas and whatever else. Don't look at my shopping cart. Then and only then can we start talking about the ability to plan meals. to plan what you're going to do in your house and what's going to be there. So that's then where emergency food pantries come in, which Taryn will talk a little bit about during her work and Emily in her work. But our work doesn't end there. Often when we talk about food security and food access, we like to talk about the free stuff. And we don't always include the important parts of the work. So we're excited today with having Kanbe's Market, having Truman here as well, to talk about purchasing food. Whether that's through WIC or through SNAP, whether that's through your own resources, that's a part of food access too. And beyond that, it's also to ensure that the people have the resources they need to always be able to get what they need when it comes to food. So that includes job training, housing, transportation. That includes all of those things, childcare. Often when we talk about food systems work, we like to push those off to the side and say that's someone else's problem. But it's not. If our families and individuals don't have a place to cook food because they don't have a home, they will not be food secure. They will not be able to process healthy food in ways that make sense to them. We have to look at this as a systemic approach to the work that's happening both here and across our country. For us, when we think of our question zero at Nourish KC, we actually say our question zero is that every individual is food secure. That is our goal. We don't want to avoid hunger. We don't want to just talk about that soup kitchen meal and that healthy food. We want to talk about what it means to be food secure. So to us, food secure means that everyone has consistent, equitable access to healthy, nutritious food. To us, food secure means that everyone understands the value of healthy food and the work it takes to produce it. To us, food secure includes all aspects of our food system, from growers to consumers. To us, our work starts locally, here in Kansas City. However, knowing Kansas City like we do, we know that we can impact much greater places than just here in our local community. We know that we are a part of a puzzle of organizations and individuals doing innovative, exciting work. We approach each of our programs as a pilot, as a testing ground, to create best practices and then to give those best practices away. With our deepest hope that we can inspire conversations like this one across the country and around the world. We go about this through our mission statement, which I have to admit is being workshopped with our rebrand, so it's a little messy, so just bear with it. Nourish KC inspires, convenes, and promotes evolving opportunities for anyone to recognize, embrace, and champion dignity, and cultivate, understand, and sustain a food-secure region. It's a lot of words. And it's a lot of words on purpose. The one thing we know about our work is that we all enter it at a different place. And we have to start by understanding our values and our needs and our personal theories of change. There's a lot of work to be done to unify our food system, to ensure that we as a system can always provide that healthy food to anyone and everyone. For those of you that are a little more linear thinkers like me, I'm much happier with this image than the other one. We believe that if we work together, and if we hold core values at our belief, and we keep that question zero ahead of us, that we can actually take a person from hungry or food insecure to food secure. That we can move our entire community, that here in Kansas City there should be no reason that anyone in our community does not know where their next meal is coming from. That doesn't mean they're paying for it all the time. That doesn't mean they know how to cook it all the time. They know where it is and they know they can get it. That's a bold statement that often we don't make in our work. I think what's exciting is there are several partners, many of you in this room, that are working to actually create a system that transcends all of us as individuals, that transcends all of us as organizations to look at what it could be if we did something different, where we got out of our own way and we focused on what needs to happen for those in our community. So today, as we listen to all of our panelists and presenters, I want you to step out of yourself. So if there's a moment where you're like, ooh, that's not the way I would do it, you need to check it. if there's a moment that you're like, I never thought about that, you need to write it down. We want you to lean in today, to step on the balcony and to hear what is happening and find ways to authentically engage in this work. So after the presentations, when we do our panel, we hope that you'll dig in deeper with us to look at what we can do to make a secure region where everyone has access to the healthy food they need. We're going to start this conversation with my good friend Taryn from Harvesters, where she's going to talk about health in the emergency food system, our food pantries and soup kitchens.
Good morning. Good morning. Everybody hear me? Okay. So I put way too many slides on here, and I am really going to have to cut down, so here we go. The reason being, I think everybody knows the name Harvesters. I don't know that everybody knows all the things we're really trying to do to rethink the intersections of hunger and health, and so that's where I was like, I have so much to share. But I probably did a whole meeting just for myself for weighing in, but that's not going to happen. And I'm sure that's probably how everybody feels, actually. So there's a lot happening with Harvesters. A couple of things just to give you a little bit of context. Number one is historically food banks have mostly operated in the shelf-stable realm, right? Boxes and cans. And a lot more so, we're changing a lot of our infrastructure. We're asking a lot of our agencies to change their infrastructure as well to be able to hold cooler and refrigerated or freezer refrigerated types of items because we're getting a lot more produce. We're intentionally seeking out a lot healthier foods. That's number one. That has a lot of words on there I'm summarizing. Again, I think there's a lot of confusion about what does food security mean, and there's a lot of definitions out there. There's a lot of definitions. And so the definition that I like, I don't think it's full yet, but when all people at all times have access to sufficient, safe, nutritious food to maintain a healthy and active life. That is very different than I don't know where my next meal is coming from, right? It's sufficient, it's continuous, it's healthy. It helps them maintain a healthy, active life. So a little bit higher definition than maybe what other people have thrown out. This kind of gives a lot of stats on who we serve. I want to point out the mission statement. We feed hungry people today and work to end hunger tomorrow. And I think that also speaks to what Beau was saying. And there's the ultimate, there's the today. We can't ignore today, but we also have to work towards tomorrow. And how do we get people back on their feet and out of this cycle and give them the tools when they get back on their feet? How do they know how to cook some of these items? Are they aware of some of these items? Do they have the equipment to prepare some of these items, etc.? And then our vision statement that everyone in our community will have access to enough nutritious food to maintain a healthy lifestyle. Again, primarily we're the warehouse, the distribution mechanism. We're also, by the way, in 26 counties. I think that's new. That was new to me. I'm from Kansas City, so I thought, oh, this is like a KC thing. No, we're rural, urban, suburban. I think that also helps you understand kind of what we're working with. We're with over 600 some agencies in those 26 counties. And we're putting out at least 46 million, I think last year was more like 50 million pounds of food within those 26 counties, 17 million of which was produce. So we're really amping up the produce, and besides that, shelf-stable, healthy kinds of things. So back in 2014 was the first time, so let me back up. Every 4 years there's a hunger study, and this is a nationwide assessment of who it is that we're feeding. So we ask a lot of the people who come to pantries and kitchens, what are your demographics? Are you a veteran? What is your age? What's your education, etc.? In 2014 was the first time, sadly, but also good to know, the first time they asked some health-related questions. They only asked a few, but they did ask questions like how many of them experience high blood pressure, how many of them experience diabetes, how many of them are choosing between food and medical care. So this is no news to you guys, but this is a cyclical reality, right? So if we're feeding them food that has high sodium, if we're feeding them food that has high sugar, all of these things, that might exacerbate any chronic conditions that they're dealing with, right? That's going to exacerbate their poverty and a variety of things. They're not able to pay as many medical bills, as many just electric bills, etc. So how do we get out of that cycle? What is Harvesters and what is our agency's roles and responsibilities that we can call them into? Some of them are already there and they're already saying, yes, we know these things. Some of them are like still don't quite have that vision because that's not how food banking came to be 40-some years ago, right? So we have agencies at all ends of that spectrum, and we're trying to say, what can we do here? So, I'm cruising real fast, people. Some coping mechanisms that people called out. Some of these are going to be healthy, some un. A lot of these I would say anecdotally we kind of knew, but now we have some stats. We even do have it broken down in some counties if there's enough aggregate data to pull. So some of them are healthy. On the right-hand side, this is growing. A lot more people are growing food in their home or community garden. We're trying to amp that number, so we're trying to partner with Kansas City Community Gardens and others of the like, right? On the left-hand side, people are purchasing inexpensive, unhealthy food. And then in the middle, people are watering down food or drinks, and you can only do that so long you're going to be depleting your nutrients, right? So agencies, again, this was back in 2014. They're asking for more fresh fruits and vegetables, so this is why we took on a huge campaign to grow our cooler space, a lot more cooler docks, a lot more refrigerated trucks, and then we're trying to get more capacity for a lot more refrigeration units and freezer units for our agencies, right? And of course, everybody knows, great, we have a lot of cool things, but do people know what they are? What do you do with the rutabagas? So then nutrition education comes along with the extra food, right? People are asking for more protein food items like meat and then dairy products. So I'll speak to how we're kind of answering some of these. People are also asking for things like allergen friendly, and I know that Emily is going to speak a lot more to that. Low sodium, no added sugar, whole grains. Again, how do we help them not exacerbate chronic conditions? So we do have a nutrition team. We go out and teach nutrition education classes. We also have partners in the community who become trained to teach these curricula on our behalf. We provide funding, and they just have to give us all the numbers for the funding. In addition, we do all these other things that I'm not sure you're aware of, so boom, I'm going to hit it. All right. We have mobile food distributions, which are primarily produce. This is where it's like a pop-up pantry for the day. A truck pulls in, people line up, we distribute all the food off the truck, people leave, there's nothing left, there's no brick and mortar, right? We're also trying to increase a variety of ways that the pantries work with their guests. Some pantries are pretty transactional in how they handle and work with their guests. Some are a lot more relational. We're trying to move them across that spectrum to be a lot more relational, understand their guests a lot more. What do the guests need? What are gaps in the services that they're not getting right now? I've said that. We are working on a variety of healthcare setting pantry pilots. We have one at Samuel Rogers in the West Side right now. It's a very intensive diabetes initiative where it's a year-long program, grant funded. Anybody who is already diagnosed with diabetes goes to their physician once a month. They get their numbers checked. The KC Parks and Rec has a physical education component. We provide a diabetes friendly box of food. And then there's also an education piece that all happens. This is happening every month for a year, and we're trying to see at the end of the year, what do their numbers look like? Because they have a physical education component, they're seeing their physician regularly and getting regular checkups, and there's some food components. So there's a lot of variables. We can't take all the credit, but we know that all these things are highly important for individuals with diabetes, right? There's a lot of diabetes research happening at the national level through Feeding America. So you can always go, there's a great website called hungerandhealth.org. A lot of research, brilliant information out there about the effects of SNAP on people's health and income and on their upward mobility. There's a lot of good research on there. But hungerandhealth.org is a great place to go. But that's where you can also find out a lot of this diabetes research. It's called Faith DM. We provide a lot of recipes to our agencies, both to the agencies and to the individuals so they know how to use those items. We do have a SNAP outreach department. Their whole gig is just to go out and enlist people for SNAP, because again, we know that the free food isn't the only answer. That is one piece of the puzzle. How do we get people spending money, stimulating the economy, making their own choices, right? And then I've spoken briefly about the ways that we've increased our infrastructure. Oh goodness, I skipped something. Here we go. We are coordinating, currently we're doing a pilot with Research School of Nursing to get nursing students out that are in the KC metro area. This is a pilot just this semester, so higher level nursing students go out with their professor as part of their population health class. Go out to our agencies, we ask which agencies might like to try this. And then as we work through those kinks, we're gonna try and roll it out to other nursing students, other nurses throughout our entire 26 counties to see how do people know about their health conditions, but then how do we educate them point in time right there at the agencies so they don't have to make another appointment. down the road for another day when they're trying to, transportation is an issue, time is an issue, money, all of the above. We do provide healthy cooking classes for kitchen staff and volunteers, so we bring in chefs, and we just say, anybody who operates a kitchen in the KC area, you want to come and learn some new skills. And some of them are highly qualified already, full-blown chefs, and some of them are not. And so how do we just give you a variety of new tools in your tool belt if you're cooking in a lot of these kitchens? And I know that Nourish KC sent over their chef and their dietitian, Vista, and I'm sure we didn't teach the chef a whole lot of new things, maybe necessarily, but he was a great addition to the team. Because not all kitchens are trying to do what Nourish is doing, what Bishop Sullivan is doing, where they're trying to be very intentional about cooking healthfully, right? We're trying to work on healthy food drives. I have a list over here, I'll throw it over there, on educating our donors. So those individual donors as well as those corporate donors. What are things we would prefer that you donate? We're not going to say no at this point if you're going to donate the soda, because everybody gets a choice. But please do intentionally try to donate the whole grains, the low sodium, etc. So we're really working on our donor base as well. We have Plant Row. We're working with gardeners. Please give us your surplus, extra things. Milk to My Plate is a very intentional partnership with Heartland Dairy, where pantries get a delivery of fresh milk. It's not like, oh, the stuff that's about to, on its way out. Fresh milk that they pay a nominal price on. You can't get it anywhere for that price. And it's delivered to their site, which is brilliant, rather than having to come pick it up. So Highland Dairy and Feeding America, that's a national partnership that has been very successful. One of the new initiatives that my department is focusing on a lot more, we used to do a lot of health and nutrition education. Now we're doing a lot less of that, and our main gig now is to consult with pantries and kitchens. So what are you wanting to work on? How do we help you get there? Some of them want a deep dive, some do not need that deep of a dive. But it can be a variety of things. Do you want to change over? I don't know how many of you guys have been to pantries, but some of them it's pre-bagged, and clients don't have a lot of choice on what they're getting. And then some, it's all the way to full-blown what we call client choice, where it looks just like a grocery store and clients have all the choice in the world. Well, except for sometimes there's like, take two within this category or something like that based on household size. So that provides not just more dignity, but also more education, so clients can turn over, look at that label and say, this is what I need, based on my dietary conditions, but also just based on what I have in the pantry. I don't need more peanut butter. I have 10 things of it in my kitchen already, right? So that's one of the things we're doing. It's a lot more of a consultant role with our pantries and kitchens. We launched webinars this year. So we had a webinar with the ADA back in September. And we just talked to our pantries and kitchens about what is diabetes, first of all. What can your role be? Again, giving them a new vision for what their role, because I really envision them as the gatekeepers. Harvesters can get a lot of healthy food, but if you're not selecting it from our menu, it will never get down to your guests, right? So you are the gatekeeper, so if you don't have a vision for what your role can be in that community, it will never get to those guests, right? So how do we get buy-in? And then showcasing what some different agencies are doing, because there's 600 some agencies in a big span of like 6 hours, from one spot to another. So they don't know even what others are doing. So we want to say, hey, here's what I'm doing over here in Lecompton, Kansas. Hey, here's what I'm doing over here in Marysville. And they can kind of spotlight and say, come visit or call me, so that way they're not trying to do it all in a silo, which is very much happening, unfortunately. Working with the American Heart Association, trying to figure out ways to educate our pantries more on heart health. And then other providers. We're trying to work with dietitians, nurses, WIC, etc. to say, what are ways so we're not reinventing the wheels here, right? We're going to have a focus group with partner agencies to find out, are you ready for more? Because we think there's a lot more capacity that we could be doing more, so we're going to launch that next month. And then there's hunger vital signs. I don't know if you're aware of that, because I got to wrap up. There's 2 key questions that healthcare providers can ask at intake, depending on your electronic medical records that can be put into the EMR. And so these are ways that healthcare providers can ask people if they are food insecure or not. And then it can become a referral process to a local food pantry. So if you are not aware of this word called the hunger vital signs, we can talk more about it afterwards. It's also going to be on hungerandhealth.org. It is best practice across the nation for healthcare providers. Okay, thank you. Next is going to be Emily Brown with the Food Equality Initiative.
Hello. Okay. My name is Emily Brown, and I'm with Food Equality Initiative, and we have a mission to improve health and end hunger in patients with food allergies and celiac disease. And our primary means at this point for doing this is through prescription pantries. So we currently operate 3 prescription-based pantries for low-income patients with food allergies and celiac disease. And I say low-income, but really it's low to moderate income. We serve patients up to 250% of the federal poverty level, which is roughly about $62,000 for a family of 4. So not just, your traditional, what you would see for qualifications for SNAP or for WIC. I'm not sure how familiar you are with food allergies or celiac disease, and I'm not going to go too deep into the clinical diagnosis, but basically if you have a food allergy, your body has an immune response and it can be deadly. It can be very severe, and patients who have food allergies must avoid their allergens strictly. And the top 8 common food allergies are milk, eggs, wheat, soy, peanuts, tree nuts, shellfish, and finfish. And so those 8 allergens cause 80% of all food reactions. And so Food Equality Initiative really works to help families have the right food, the safe food, every time, so they don't have to make that difficult choice between hunger and health. And so I put up here our prescription model just so that you can kind of see how our program works. We advocate for food insecurity screenings in the clinical setting, just like the hunger vital signs. It's the exact same 2-part screen. And once the patient has been identified that they are food insecure, the doctor writes a prescription. We receive that prescription in our office, and we enroll them in services if they meet the financial qualifications. So those are the only 2 qualifications for services: that you have a diagnosis with a prescription diet order form completed by your physician, and the income guidelines at 250% or below federal poverty level. And so once patients are enrolled, they're able to utilize services at one of our 3 locations. We just opened our 3rd location last night in Blue Springs, Missouri. So we're currently open in South Kansas City in partnership with the Community Assistance Council. They are in the area. There's 1 location in Blue Springs, and then we have a little free pantry in Wyandotte County at the Children's Campus, right outside the Project Equal Clinic. So patients come to the pantry, they shop once a month, and we stock foods that help them keep their, so that they can make safe and healthy meals. And I'll talk more about what is in our food package in just a moment. Let's see, I'm having problems. I have a Mac, so I'm like struggling here with this PC. How do I go to the next?
Those are great commercials.
It's not working. I have this beautiful chart I want you to see.
Yeah, no problem.
Okay, thank you, Beau. Okay. So this is our chart on the impact of food allergies on the food budget. And so all the prices here were collected at the Sun Fresh off of 31st. So you'll see here, the average cost of milk in Kansas City is, about $4.50. And if you have to buy an alternative milk, like almond milk, rice milk, soy milk, flax milk, you'll see how the price increases. And I just want to note, some people are like, oh, but I spent $4 on my almond milk, but chances are you spent it on a quart, not a gallon. So when you add up the cost of what a gallon of milk costs, if you have to pay for an alternative, that's what you're paying. I'll just give you a personal example. My oldest daughter was diagnosed with multiple food allergies at age 1, which is really what led me to this work. And we were paying over $15 a gallon for hemp milk. And I mean, that's not sustainable even for middle income families. And for low income families, it's impossible. So you'll see, I also want to point out the cost of peanut butter. It's $1.82. But if you have to buy an alternative like sunflower seed spread, it's $7.49. I will say you can get it for $5.99 in Johnson County at the neighborhood Walmart. But if you don't have a car, you don't have transportation to get there, that's what you're paying in the heart of the city, $7.49. So as you can see, some of these prices have gone up, 1,000%, 400%. And that is very difficult for families to sustain, especially, like I said, if they were struggling with $4 for milk. How then do they pay $7 or $8 for the same product? So what does research show? There was a study by Dr. Robert Woods at Johns Hopkins that showed 9.9% up to an estimated 15% of children in the inner city have 1 or more confirmed food allergies. This was done over a 5-year study from birth to age 5, looking at cities like St. Louis, Baltimore, Chicago, New York. And I can tell you from the research that we've done internally connecting with partners like Head Start, Mark Head Start is showing 20% of their students enrolled have 1 or more confirmed food allergy. And so when you think about that and you recognize the income level of students and families enrolled in those programs, they have safe food when they go to school, but do they have safe food to maintain their health at home? Chances are that they're not, and they're making very difficult choices. They're, rationing food, or they're not paying the light bill, or, making those very difficult choices, or ended up in the ER. I just saw a study last week that was published from Blue Cross and Blue Shield's national research, where they showed a huge increase in anaphylaxis in the ER. And I can just guarantee you part of that is due to people not having the resources they need to manage. And so we think about the management of a condition like food allergies or celiac disease. It's only really managed by what you eat. And so looking at the next statistics, 21% of children diagnosed with food allergies experience low food security. But when you just saw that chart, you could see how that is, where a family that may have been managing, and then they get a diagnosis that tips them over the edge where they can no longer provide adequate food. Okay, so this is just a snapshot into the pantry. We do consider ourselves more of a supplemental food program, even though we're functioning within the emergency food system. We know that our clients, for the most part, unless their financial situation changes drastically, they are going to need to utilize services on a regular basis. And so we provide 4 different types of non-dairy milk. We stock gluten-free flours, cereals, mixes, breads, grains, like we do brown rice. We also do alternative grains such as millet and quinoa. We provide substitutes for egg allergy. We do applesauce, chia seeds, as well as egg replacer, which is a product that helps people bake without eggs. We also stock alternatives to peanut butter and tree nut, like sunflower seed spread, and also fresh produce, because we know that's important. We can all use more produce in our diet. And so we provide those items at no cost to our qualified clients. We are, just like Beau talked about, moving people through the system and not just providing free food, empowering them to have access at the retail level. Just this month, we launched our pantry product vouchers coupon with Sun Butter. So we no longer actually stock Sun Butter on the shelf at the pantry. Our clients are able to go into the store, wherever it's sold, and get it for free with our voucher. And then we're able to track the redemption of that voucher. And we're hopeful that all the work that we're doing to pilot access at that level also helps influence our work to amend the WIC food packages to have more allergy-friendly and gluten-free options during the next review. So I think that's all I'm going to say for now, but I will have some pamphlets on the table in the back later so that you can learn more about our program and refer patients or families that you know need services. I'm sorry, I've like totally messed up the... Okay. It's not cool.
Mac users are not allowed to touch this.
Sorry.
You didn't have to wait.
Yeah, so this is all we get, so if it wouldn't have worked, I was just gonna blame you and be like, oh, well, I had a great but this is all we get, and I'm feeling really bad. My name's Max Kaniger, I'm the founder and executive director of Kanbe's Markets, and I'm really so excited to be here and get to kind of share our story with you guys. But I did put together a presentation, and as being a little bit different organization, I know some visuals could have helped. Anyway, so moving forward, we are just kind of a small piece in all of this system that I really believe in. I think that what led me to start Kanbe's Markets is seeing the work that all of these other great organizations have been doing for so many years. They've made such huge strides, and I think we can be a kind of missing piece to really make this system, we can fix the system. Where food is, fresh, healthy, and affordable food is accessible to everybody in this country. And so our piece of that is working with corner or convenience stores in the inner city or in food deserts and helping them stock fresh produce. So we bring in mobile coolers and stands at no cost to the convenience stores. And then we also help them stock it, so I was actually there this morning. Restocking, we've been delivering now in 6 locations for about a month now. And in that month, we were able to distribute just under 20,000 pounds, which I'm excited about. And we're not where I want to be. We had a pilot program last year that was doing considerably better. So like right now, our weekly sales per store are only about $200 a week per store. And we're able to move that kind of food. And I think that $500 a week per store is very, very possible. And with that, if we were to move into just the 18 stores on our waiting list, that would be almost $500,000 a year in sales in that part of the city. And almost $200,000 then that the stores in that community get to keep, which lets them hire new people, lets them stock different things, lets them kind of promote their stores and be stronger in their community. A big part of why I want to work with those store owners is that they are ingrained in the community. When I go in, the guys behind the counter know everybody else that's coming into those stores. They are a real part of that community and they know the people there. And so they, I think, are the best way to kind of respond to this issue rather than me coming in and saying this is what I have to offer. But as we kind of continue to grow and partner, I think the possibilities to this can be kind of limitless. Because right now, working with just one of the local wholesalers. That's all we really need. They've got plenty of extra food. On the other end, where we're picking up produce, all of the food that we get is either donated or we are buying some, but regardless of which, the food that is donated to us, we're keeping out of landfills. So a lot of that food that's donated is stuff that is not really available for them to sell to grocers anymore. It's not really that grocery store kind of perfect, so they're just going to throw it away. They don't have the manpower to sort through and organize it and pull off any rubber bands or packaging to keep it, so that it could be composted, where that's something that we can do. On our level, we can kind of sort, organize, and get it to where it needs to be, so that if it's not going on the shelves, it's still not ending up in a landfill, and we can make sure it's getting composted and turned back into great soil for the local farmers, who I then want to support because we are able to get a lot of that food donated and still sell it. The sales from donated produce can kind of offset produce that we have to buy. So stuff that, if we do need to stock good quality stuff that they don't have available to donate, we can either buy it from the wholesalers, from grocers, or from local farmers to help them, again, be more sustainable. So as we've talked to a few local farmers now, we are moving food in the kind of volumes that really make it easier for me to then go in and say, whatever you have left, I will be able to buy. And that's something I'm also excited about as we grow. But that's just kind of a quick synopsis of what we're doing. I think Justin's up next with the local market. We'll talk more in a minute.
And I don't know how many of you know this, but while Max is, or while we're transitioning, I want to congratulate Max. I don't know if you heard his KCUR interview with Devontae at the Cakery. If you're not familiar with Devontae, it's the Cakery is a store at 35th and Troost. They now
31st and Prospect.
35th and Prospect. 31st and Prospect.
Mm-hmm.
Max has been taking produce into the Cakery. I'm not sure for how long, but they were asked to participate in an interview on KCUR. It was fabulous. If you haven't heard it, I encourage you to look that up and listen to it. So with that, I'll turn over to Justin.
Well, I don't have any slides either. Just have to stare at this bus here. So my name is Justin Moss, and I'm with the Healthy Harvest Mobile Market, which is Truman Medical Center program. This is a 40-foot retrofitted bus donated to us by the KCATA. And we have turned the inside into a little market. So on one side there are fruits, and the other side there are vegetables. We buy from 2 different vendors and sell basically at cost, and Truman picks up the tax. So this is not a profitable program. And our idea here, as we go into this season, we begin our season, 2018 season, next week, actually. And Janet and myself will be on the bus. So we're on the front line, out there on the streets, excited. So we have these, the mobile market route. We brought those so that everyone can take one and post it or disperse it as you wish. But these locations that we chose, we really looked at the chronic disease prevalence by census tract in Kansas City, and we're going into areas that have very high, relatively high, high blood pressure prevalence, high cholesterol, and diabetes prevalence. It's pretty astounding when you look at a map with all of these census tracts in Kansas City and look at chronic disease prevalence. You're looking at, oh sorry, I don't have a microphone on. You're looking at Troost, and on this side of Troost, it's 30 to 50% high blood pressure prevalence. So individuals who have indicated they have been told by a medical professional that they have high blood pressure. On this side of Troost, on the west side of Troost, it's like 5 to 13%. So we're looking at, it's pretty drastic. So we're just infiltrating areas that need it the most. and strongly correlated with food insecurity. So that's it. I don't have any slides, I'm sorry guys.
Good morning, my name is Donna Martin, I'm from Mid-America Regional Council, and I am the program director, I guess you will call, for the Double Up Food Bucks program. I also do some other public health planning in general, but that is my main focus right now. So I have also, I think I've seen a lot of your faces in the last 2 years. We've been trying to keep you updated and keep you apprised about what's going on with Double Up Food Bucks. So I'm not going to give you a whole lot of the background slides because I feel like most of you know a lot about the background and where we've come from and how we've joined programs. So we'll get right into kind of where we have been in 2017 and where we're headed in 2018. So this is the only real general, like this is our basic about the program. So Double Up Food Bucks, for those of you who don't know, has kind of 3 main goals. I call it the bar stool, if you will. So we want to be bringing families more healthy food, definitely. We want to be supporting our farmers, and we want more of the dollars to be staying in our local economy so we can repeat and repeat and repeat all of those other things. So how does this Double Up Food Bucks incentive program work? It's an incentive program. Basically, goal is to get folks to eat more fruits and vegetables. So at the farmers market, this program works at farmers markets and grocery stores, and I'll kind of get into a little bit of the location things in a moment. So at farmers markets, what an individual does is they go to the booth where there is the EBT machine. Usually it's just one booth, it's like an information booth, or one farmer who has the machine. The person at the booth will run their EBT card through the machine. They'll ask, how much do you want to get off of your card? They say $25. So if they get $25 of SNAP tokens, those tokens can be used for any SNAP eligible item at the market, just like they were using their card at the grocery store or other locations. Then they will also get a matching amount up to $25 a day of Double Up Food Buck tokens. And those tokens can be used for any fresh fruits and vegetables at the market. And we work with markets that have sort of a rule that their farmers have to sell the foods that they actually grow. So they're selling locally grown food. And then they have their 2 sets of tokens and they go shop. So hopefully they're buying lots of great fresh fruits and vegetables with both of their different kinds of tokens. So in the grocery store, so this is the way the incentive has worked for the last 2 years. The customer has gone in and looked for the locally grown produce, and so we've worked with the different grocery stores to really try to label the items so that it's very obvious what those are. When they buy those items, for every $1 they spend on locally grown produce, they have gotten $1 to buy any fresh produce. And that usually, the reward usually comes as either a coupon in some of the very small grocery stores, like in St. Louis, or on a loyalty or store account. So usually they use it the next time they come in because they've made their transaction and then they'll use it the next time they come in. So sorry for the small numbers. This is just kind of a summary of the locations that we had going on in 2017. We had 144 locations total, and we were functioning from as far west as Salina all the way over to St. Louis. And I think St. Joe was fairly much the northern part all the way down to Pittsburgh, Kansas. So it's a very large geographical footprint. And in some areas, like in Kansas City and St. Louis, I feel like we really are covering most, I won't say all, because we do have some gaps, but we have a lot more coverage, and then in other smaller communities, there may be only one farmer's market. So that's part of a challenge of the program that, you know, we continually try to figure out how to tackle. But you can see, like in the St. Louis area, we had 68 locations, and in Kansas City, we had 36 running in 2017. And then we're kind of eastern Kansas, and then other than the northern part of Missouri, I think we're pretty well all over the state of Missouri. Okay, so this is a lot of numbers, and I don't expect you to digest all of these numbers at all, but I did want to point out 4 different elements on this chart. So first of all, if you see our total for last year of incentives redeemed. So these are the incentives that actually customers came back and used. So they earned them and then they came back and redeemed them. So they're either using their tokens or they're coming back to the grocery store and buying fruits and vegetables. So we redeemed almost $295,000 in redemptions last year, and I think that was more than almost double what we did the first year. So we're growing. We are making progress. It is actually every single sort of line that you see had improvement from the first year. So that's really encouraging to me that we are making progress, even though sometimes we have challenges. The second piece that I think is important to look at is the very bottom of the second column, the total number of transactions. Now this is not unduplicated SNAP customers, but it's a whole lot of transactions. So, 1,300,000 plus transactions that were happening that involve some sort of earning or redemption, which I feel like is a positive number. I think that's a good thing to see. That yes, we are touching lives, we are touching households and families. The third thing I wanted to point out was if you look at the percentages redeemed, you'll notice that farmers markets are rocking the boat, all by and large. Now I will have to say, add a caveat to that one of the things that we've learned is that there are some that are totally rocking the boat, and that some are a little tipsy. So that isn't, that's overall, those are overall numbers for the farmers markets that we're working on, and some are really rocking the boat. And really the lesson we've learned there is that farmers markets that have sort of the organizational structure to be successful in themselves. Not talking about a SNAP program, not talking about an incentive program. They are successful themselves. Those are the best farmers markets to be successful in a program like this. And those are also generally the ones that have a good number of vendors, and the vendors are selling a variety of fruits and vegetables. The ones that aren't meeting those criteria are struggling with, I think, struggling overall and struggling with this program is fair to say, Jen? Okay. And then the fourth thing I wanted to point out is that, back to the third point. You'll notice the grocery stores are struggling still a little bit. They're doing better than they were last year. Well, Schnucks really wasn't doing anything in 2016 because they crashed their coupon program. So they have really improved. And then Price Chopper is still seeing some IT issues in the Kansas City area, so they're trying to get to improving, so it's an uphill battle, and we've learned a lot through that program. The one thing I really want to point out, though, that brings me hope about the grocery store program
is the numbers that you see in terms of the number of SNAP transactions for grocery stores in the second column. They have potential to reach a lot of people. And that is where we really need to put our focus in the next year or two. Is really what can we do to help this program really ramp it up. We'll get to that in a minute. Okay, so as I mentioned, crucial elements for success. These are really the things that we've gleaned over the last 2 years that seem to really be important for how to make this a success overall. You have to have a system, whatever it is. If it's an EBT machine, it has to be working. Okay, if you have a farmer's market, they don't have an EBT machine that works, you're not going to have this. You're not going to be successful on this program. Same thing with grocery stores. If your IT system, if your point of sale system isn't able to identify fruits and vegetables being sold, that kind of thing, you're probably not going to do well. Training of your people. If your cashiers or your vendors don't know that you're doing the program, that's a big problem. And we've had a lot of customers very frustrated with, going through the line and the cashier didn't know what was going on, and it's humiliating. We take that so seriously. So we're working on that. Communication to SNAP customers. That is, well, I'm going to really harp on that with you guys really for the rest of my presentation, because getting the word out in the community is hugely important. And so I'll have an ask for you, and then letting people know how it works when they're actually in the location is also hugely important. And then finally, obviously, having fresh fruits and vegetables available, that is really important. One of the issues we have with the Schnuck stores in St. Louis is that we realized their locally grown produce was pretty limited. And so, when a customer goes into a store and there's only 2 or 3 items and they're not like popping out, they have no idea what's locally grown. They don't know that those items are going to actually be eligible for this program. So those are crucial items. So we're looking forward to 2018. In 2018, we're expecting 148 locations to be operating the program. We're losing a few farmers markets here and there, and mainly for some of the issues that I've already pointed out. 12 are new, 12 locations are new, and those are both grocery stores and farmers markets. So I feel like that's a strong point. And then there's always opportunity that we could be adding more locations further down through the summer. So here's the biggest change that I think we're gonna see is that our grocery stores are going to be changing the model that they've been using. As I mentioned, they were using a buy locally grown and the reward is any. We're moving to a buy any fruits and vegetables and you get any fruits and vegetables. Now, to be true to our one leg of the stool where we're wanting to still support our local farmers, we're basically moving the onus of having locally grown available still on the grocery stores themselves. So we're having conversations that they still need to work on locally grown and increasing their locally grown, but it's not going to be on the customer to have to identify what's locally grown. We've really learned that locally grown, the term local is not an understood term. People think I'm in the grocery store, I'm at my local grocery store, everything here is local. That's not what we meant. So I think this model will be a whole lot simpler for customers. I think I'm hoping that we'll really see redemptions fly out the door. So, and then for some, we may limit, depending on how fast the redemption money goes out, we may limit it to like June to September or October, depending on how fast we see the dollars, because we only have so much dollars, so. Okay, I think I covered all that. So speaking of back to communications and outreach. So these are all the different elements that we try to really have in place to get the word out. And we do have our logo that we try to put on everything that we do. We are in the process of updating our brochure. We have some brochures from last year that we'd be happy to give anyone who wants one. In Kansas City, it hasn't changed a whole lot. There's a few places that have swapped out. We have new places, and then we have a few that are no longer continuing. But we'd be happy to give you a brochure just so you have that in hand. But we will have brochures probably beginning of May to get out into the community. We have a website. We have all these different things to get out, and the hotline is a definite favorite for customers who just need help understanding the program. I'm on the other line of the hotline, by the way. It's not a recording. Signage, we really try to get the signage out to locations like farmers markets and in the grocery stores. It's crucial, and as you see, we've tried to also make it very pictorial, just to kind of get over some of the language barrier to make it simple. As I mentioned, we're updating our brochures, so the brochures will look different than this, but the other thing I wanted to mention, if you are willing or in a position where you actually have SNAP folks that come into your organization and would be willing to have brochures available either in your lobby or that you actually hand to them, please either give Jen or myself your contact information, and we'll be happy to get you some brochures once we get the new ones out, printed. So this is just our website. A lot of folks who do have the capability of going online, or probably more often than not, folks, case managers, social workers go on this site and help refer people to places. Our locations are updated on this site whenever there's a change. So this is the most once you print a brochure, unfortunately there's no going back. You either have to reprint everything or you just live with it. So this is really, should be the most up-to-date site. And as I mentioned, your organization can definitely help get the word out. We would love for you to have brochures. Also, on that website, we do put digital, like electronic forms that are not the printer kind, because the printer kind, she does different things with those. There are the printable kinds on there, but there's also those different formats that you can put, if you have a lobby TV that kind of runs different messages. We'd love this to be on that lobby TV. Emails that go out, newsletters that go out. Any way, you feel like you can reach populations that might be benefiting from this program, we would appreciate that help. I think that covers it. My last thing that I would say is that the other thing that we are willing to offer to you all, if you have, is presentations. If you have staff members that you feel like are caseworkers or dietitians or whoever, and would like us to come out and give presentations, Jen and I are, and Kathleen, new person at Cultivate KC, are willing to come out and give presentations to your staff. And even more importantly, probably, if you have classes or groups of folks that might be able to participate in this program, we would love to come out and not only give information to them about the program, but also get feedback from them. Is this an interesting program to them? Would they be willing to try it out? Or have they tried it out? What was their experience? So we would love to to have that opportunity if you have classes or groups that meet. Okay, that is our information. Feel free to contact either Jen. Jen is our program manager for the Kansas City Farmers Market, so she's out there pounding the pavement with them every summer, spring, summer, and fall. Any questions, or we'll get those later? All right, and now we're gonna have the double Emily.
You know, being an Emily, you run into a lot of other Emilys. So we always shoot for the trifecta of 3 Emilys per meeting. So we can shoot that. Well, thank you all for your time today. And I just want to say that I'm so inspired by hearing from all of the passionate people in this room today. It's just been terrific. And I think, like Beau said, we're in a moment of hope and transformation in the Kansas City area. And we're really interested in how Children's Mercy and healthcare providers in general can play a role in that, especially this connection of health and healthy food with food insecurity. So we're going to talk really briefly about just one of the things that's going on at Children's Mercy related to this, and please know there's many others as well. Okay. So one of the things that Children's Mercy's had an increased focus on in the recent years is really thinking about and looking at social determinants of health and how do those factors impact children's health and families' health. So one of those things being access to food, access to healthy food, and hunger and food insecurity. So as you all also know, in recent years we conduct a community health and needs assessment as a hospital every 3 years. And so not only are we hearing from our patients that food insecurity and hunger is impacting them, but we're also seeing that showing up in the data that's collected in that community health needs assessment. So I'm not going to spend a lot of time on that, but just to kind of frame the issue. So in this last version of the community health needs assessment, nearly 30% of families in our overall service area said that they were often or sometimes worrying about running out of food. And as you can see from the chart, it's varying by the different counties and areas of folks that we serve. And then asked in another way, we heard that 16% of our overall population were often or sometimes had run out of food or didn't have enough money to buy more food. So again, varying quite a bit from the different counties that we work in, but knowing that we're serving both sides of the state line and we're serving multiple counties, and this is an issue that's showing up for patients and families that we serve. So many folks in the hospital system are concerned about that and also really passionate about how we can best serve our patients and families and deliver services in the most comprehensive and quality way. So one of the things that's happened is establishing a hunger-free hospital task force. And Emily actually has participated in that, and Shelley and others in the room, Bill and others. And that work is going on broadly around Kansas City with other healthcare providers, and Beau talked about that. And actually there's going to be an upcoming healthy, hunger-free healthcare. That's a lot of H's.
Hunger-free healthcare.
Oh man, guys. Hunger-free healthcare summit in September, which we'll make sure to push out to you all and others. But internally, we also have that same sort of task force that's really focused on how we can, again, best serve our patients and families around this issue. So, among many other things going on, one of the things that was piloted over the last year or so was initiating a food insecurity screening within our primary care clinic. So many of you are familiar with the work that the hospital broadly and our inpatient, but we also see 17,000 well child checks every year in primary care, as well as, in addition to that, sick child visits in that primary care. So doing that food insecurity screening, actually Emily's chart was terrific in showing kind of that process. So a very similar process happening at Children's Mercy, that 2-question kind of validated screening started happening really consistently. And then the question is, so then what happens after we screen and we learn that patients, yes, are experiencing food insecurity? And so one of the things that was tried was the ability for physicians to write that prescription food prescription. So similar again to that chart that Emily showed that laid it out really nicely. The project in this first year piloted writing that prescription to the Truman Medical Center Mobile Market, one of our great partners in the community that offers those low-cost fresh fruits and vegetables that we know are the good, high-quality fruits and vegetables, and serves the area around where our primary care clinics are. And so that order, that prescription, included a $5 coupon for free fruits and vegetables at the Healthy Harvest Mobile Market, which for those of you who've been there actually does buy quite a bit of fruits and vegetables from their mobile market. And then some information about the market, like the schedule of stops, and then also aligning with the work that you all are really familiar with that we do at Weighing In around promoting fruits and vegetables. And so also providing our fantastic fruits and vegetable tip and handout that has fun, easy tips for consuming more fruits and vegetables and the benefits of those. So aligning that work that has already been happening within Children's Mercy around asking about the fantastic behaviors and providing information about that. So we saw that as a really nice alignment. And it kind of helped us get our foot in the door in terms of having a wonderful opportunity to listen. And Emily's going to share what we heard. But from Weighing In's role, this was all happening within the primary care clinics and clinical work within the hospital. And then we had a great opportunity to listen to what patients said and gather a little bit of information about their feedback on receiving this. Emily will share that with you. Oh, I did. Stretch my time, move around a little bit. So the picture, I didn't say, the picture is actually providers at Children's Mercy went and toured the mobile market before providing the prescriptions so they could see what they were referring folks to and experience it themselves. So you can see them with their $5 worth of fruits and vegetables that they were able to get when they went out that day.
Okay, so I'm briefly just going to go over the results of that food prescription and share what we've learned so far. So in 2017, primary care clinic providers at Children's Mercy wrote over 400 food prescriptions. However, very few of those prescriptions were redeemed at the mobile market, less than 20 total out of those 462 during that season of April through October of 2017. So that's when Weighing In became more involved with this effort through the primary care clinic because we had tried something similar, used a similar approach to implement that food prescription through 2 WIC clinic visits, 2 different offices. And the goal of that project was to just increase access to fruits and vegetables specifically. We found that through those WIC clinics as well, there was about 150 given out, that the redemption rate was really, really low, about less than 5% at that location as well. So after we saw that those redemption rates were really low through the WIC clinics, we wanted to learn more about patients' experiences in those settings. So we did some one-on-one interviews like Emily had mentioned, and we just talked with folks that were had participated in the WIC clinics program, and we did some one-on-one interviews, asked them some questions, and then we were also able to ask some questions of the families from the Children's Mercy primary care clinics that also received the food prescription. There were 69 families that received that prescription through the Children's Mercy clinics just in September and October, and we were able to talk to 45 of those families through a brief telephone interview that we did. The survey questions that we asked were designed to understand the factors that made a difference in redemption rates, and we also asked some suggestions about ideas that they had to improve the program. When we talked with families overall, they had really positive comments to say about their interactions with Children's Mercy, and had lots of positive comments just to make about the food prescription program in general. The respondents remembered getting that food prescription, and they said that it was described clearly at their visit. However, we know those rates were really, really low, so we really wanted to learn more about the barriers that they had to those redeeming those coupons. So we asked some specific questions about those barriers, and certain challenges rose to the top. We heard some personal barriers, like they forgot about it, they were just too busy to redeem it. But then we also heard some things about the structure of the mobile market. Folks said things like the transportation to get to the market was challenging. We heard that just the locations, the timing of the stops, and just generally how to access the mobile market was a little challenging. So across all of the questions that we asked about the barriers, the ideas that they had, the resounding thing that we kept hearing was it really has to be convenient and easy for us to use it. So, in our conversations with parents, we asked some more open-ended questions to find out more and find out some ideas and advice that they might have for us to make some improvements to the program. We also gave them a few ideas to think about and reflect on and rank in order of what they thought would be most helpful for their families. Some of the things that they said were having more mobile market stops, consider having the prescription redeemable at a grocery store instead of the mobile market, increasing that coupon value to $10 rather than $5, and broadly they said they would like to see some nutrition or cooking classes included, providing information about food resources like lists of pantries. Some spoke specifically of those that contain healthy food choices. They also said providing some food on site, maybe a bag of food that families could take right there after a clinic visit that day without having to go to an additional location. Also connecting to programs like WIC and SNAP on site, having some enrollment assistance would be helpful. And they also mentioned community garden on site, which is something we actually have in the works for this upcoming growing season, so that's exciting. So again, ease and convenience was the theme that we kept hearing families say over and over again when they talked about ideas of things that would work for them. So as we continue this work, we're looking forward in the next couple of months, in May and June, we're going to conduct some focus groups, and we're going to bring in some of those families that have received the food prescription through the Children's Mercy Clinics, and we're going to talk more in depth about ideas that they have that we can do and try to increase this access to healthy foods.
I first want you all to join me in thanking all of the present